Ever wonder why some people can eat whatever they want and seem to gain no weight, while other people can look at a Twinkie and gain 3 pounds? Well, the answer is not necessarily on their plate. The answer might be what's going on inside their body. Hi, I'm Dr. Carter with Modern Body Clinic, and we've helped a ton of people lose weight. Today we're going to talk about weight loss and hormones and what you could do about it. In this video, we're going to talk about 7 different hormones that impact your weight. There's actually more, but we're going to stick to the ones that have the biggest impact. The first one is insulin. Insulin is like the gatekeeper to the body's sugar kingdom. What happens when insulin levels go up is that it signals to your body that we have plenty of energy, and so what your body wants to do with that extra energy is store it as fat. And one of the keys is to minimize that. We really want to impact the way our insulin levels respond, and so that we don't get these big spikes and storage as fat. So there's a lot of different things you can do, but one thing you can do is do resistance training. Resistance training will sensitize your body to insulin, meaning that it will take less insulin to get the similar effect, and they won't be high for as long. So another thing you could do is really try to have our carbohydrates after training. Again, our body's going to respond differently to them in this period after working out. That will help also minimize the impact of elevated blood sugar or insulin levels. Number 2 is cortisol. So cortisol is our stress hormone. Have you ever stress ate a pizza or a box of donuts? Well, you can blame cortisol for that. Cortisol is our stress hormone. Anytime there's stress, that hormone is going to go up. It could be acute stress, like someone just cut you off, or it could be chronic stress, like you're working 60, 80 hours a week. Both of those are going to raise our cortisol levels, but it is really the chronic stress that is a problem. And that's because what cortisol does is, one, is going to increase our appetite. Another thing it's going to do is make our bodies want to hold on to fat, and particularly around our abdomen. What can we do to make sure our cortisols are in a good place? A couple things you can do. One is really making sure that you're giving yourself time to recover. So that means sleep. Get enough sleep and rest will help keep our cortisol levels down. Another thing you can do is activities that are relaxing. So that could be working out, that could be reading a nonfiction book, that could be meditating, that could be taking a short walk. All these things will help bring down our cortisol levels, and that we are not getting extra fat storage or more appetite. Number 3, leptin. Leptin is a hormone that is not really talked about that often, but what leptin does is tell your body when it's full, but sometimes it doesn't listen. And when it doesn't listen, that's called leptin resistance. So normally your body responds to meals by increasing your leptin. The brain like, okay, we're done, we've had enough food. Sometimes the brain's not listening, and that's when we have high leptin levels for a long time. Now, what can we do to reverse that? Because if our brain is not listening to that signal, then we're going to eat more than we normally would. One of the things you can do is related to insulin, exercise. Eating more complex carbs can help do that, because we will have less of an insulin spike when we have complex carbs. So that would be something like oatmeal or brown rice. These are complex carbs that the body will digest slowly. Another thing you can do is exercise. Exercise will help normalize leptin levels as well. Number 4 is ghrelin. So ghrelin is your hunger alarm clock. So ghrelin is going to tell you when you're hungry. And so what can happen is we can get ghrelin levels that go too high, and that is usually in response to stress. One of those things is ghrelin levels we want to manage, and ghrelin can be a bit high if we're not getting enough sleep. Also for stress, ghrelin levels can go up too. So ghrelin, what it's going to do is, one, is going to increase your appetite, and also is going to tell your body, let's try to store this as fat. What can we do to really optimize our ghrelin levels so that we're not having more hunger and more storage of fat than necessary? A couple things. So one is definitely get enough sleep. If we're not getting enough sleep, then our ghrelin levels are going to go up. Another thing is protein. Protein will actually help decrease your ghrelin levels. So you want to make sure you get enough protein. For most people, assuming you don't have any significant medical problems, that would be about a half a gram per pound of body weight at minimum. So if you weigh 200 pounds, that would be 100 grams of protein per day. Again, that would be the minimum. Most of my clients actually advise more. Those are 2 things that can really help with your ghrelin levels. Number 5 is estrogen. Now, estrogen is not just about femininity. It also plays a role in managing your weight. Too little or too much estrogen can lead to weight gain, especially in women. What are some things we can do to make sure or help our estrogen stay in a normal range? One of the things you can do is phytoestrogens. These are foods that have an estrogen-like component or molecule in them that your body will respond to. Flaxseed is one of those foods that have phytoestrogens in them. Also, legumes, these are a good source of phytoestrogens as well. Another thing you can do is exercise. Exercise will actually help normalize your estrogen levels as well. Number 6, testosterone. Now, testosterone is not just for men, but it's important for women, and it does impact your weight as well as muscle tone. Testosterone is important for a lot of different things, but one of the things it impacts is your metabolism and also your muscle mass. There's a few different things that we can do to manage our testosterone. Actually, there's a lot of different things, and if you want us to make a video on that, comment below testosterone. But one thing is sleep. You want to make sure you're getting plenty of sleep, really optimize those levels. If you don't get enough sleep, then your testosterone is going to be on the lower side for sure. Another thing you can do is lift heavy weights. This is also something else that will raise your testosterone levels. Number 7, last but certainly not least, thyroid hormone. Your thyroid hormone manages your metabolism, but sometimes it goes off track. Thyroid can really derail your weight loss efforts. Again, this is something we want to optimize for. Now, there's a lot of different things that can wreck your thyroid, including autoimmune disease, but sleep is a big one that can really derail it as well. Of the things that you can do to help optimize this, one is making sure that you're getting enough sleep. Other thing you can do is making sure that you're bringing in the right nutrients into your body. Some of the elements that are not common but the thyroid needs is one is selenium. This is a mineral, and you can eat 2 to 3 Brazil nuts and get enough selenium for the whole day. It doesn't take much. Another mineral that your body needs is iodine, and you want to making sure that if you think thyroid is a concern, making sure you get enough iodine. So iodine is, you can find that in seaweed, you can find that in shellfish, liver. These are all great sources of iodine. So there you have it. Those are the 7 hormones that have an impact on your weight loss and things you can do about it. Now, it is true, all these hormones I just mentioned, there are blood tests for. Ghrelin is used for specific situations, but the other ones, we can all get tested on if there's any question, if those are an issue or causing symptoms for you. But the biggest takeaway, obviously, is one, making sure we get enough sleep. Those are going to impact everything. Making sure we're doing some type of exercise. Those are also going to impact all these hormones. And making sure that we're eating a balanced diet and minimizing processed foods. There you have it. If you need help losing weight, check out the link below. We have a free mini course on how to lose weight without starving. Otherwise, if you found this helpful, please subscribe. We'll see you next time. Check out one of these videos on weight loss.